have to appreciate the fact that these issues that exist in the diseases we talk about in the book have been made available to them for many years, but they haven't done anything about it. So the patient really has to become thoughtful and become self-educated. And suddenly you have a patient population that knows about a problem and a solution, which is a very different database than just complaining Uncle Charlie died of a heart attack or Uncle Charlie died of sudden death or heart failure. That's not an answer. That's just an issue that comes up. But you don't have a way of turning it around. And what I want to do is be sure that the items that we talk about in this book become known, because the solutions have been validated by people all over the world. And they should realize that solution is at hand. This book is very different because the endpoints that are achieved in this book have been learned, for example, the 3 to 5 years of each section we talked about. And we have about 10 sections in the book about new treatments of diseases. So the reader then becomes aware that there is a problem. And most importantly, the reader finds a solution. And when they find the solution, they have to say, what do we do with this? Because it's something I read in a book, but what does it mean? The first job, I think, is for the reader to approach their colleagues and say, hey, did you know there's a problem? And make other people aware of the fact there's a problem. And not only that, but show them that we have an answer. So then the reading or viewing population begins to appreciate that there are dilemmas in healthcare that have been a major difficulty in a variety of diseases, such as heart attack, heart failure, sudden death, a number of things like that. And then they find a solution. The next thing they really have to do is to go to their physician and to ask their physician if the physician's aware of this problem. And the physician may or may not be aware of it and say, well, here's a problem I read about, and there's a solution, and point to the physician to the fact there's something in the book telling him an answer to the problem. Finding the question is not good enough. You have to have a question plus an answer. And when they do that, they have to realize that the physician has to begin to think about learning something differently.